Mental Health Awareness Month, and mindfulness and meditation are two of the most effective tools to help manage emotional well-being, especially for people with migraines. Things like stress reduction, slower breathing, and connecting with your surroundings can help mitigate migraine pain. But how do you focus on meditation during a flare-up? Well, Dr. Cynthia Armand is with me again here in Studio 57 to discuss some of the tips to help combat migraine pain. She's a neurologist and headache specialist at Montefiore Medical Center in the Bronx. So I think of mindfulness as something that helps you emotionally. It can, and there's a physical thing happening that's causing a migraine. How does meditation and mindfulness help with a migraine?
Yeah, so this is an exciting topic in migraine medicine because for years it's been backed by research. And essentially what mindfulness and migraine is, it's focusing on the present in order to help individuals who cope with migraine disease. And it's essentially brain training for helping individuals deal with a migraine attack. So in recent years, there's been research that showed that it can reduce how often the migraines occur, how severe they are, and even the level of disability associated with it. So really, it's remarkable what it can do. And I often talk about this with my patients.
That is fascinating. But when you say sort of focus on the present, I think if you have a migraine, I am presently having a migraine. Exactly. And you would think focusing would not work. Give us some tips for people who are trying to attempt to do this, but, you know, they're still suffering.
Right. So mindfulness practice is multifaceted, and one type can be going out for a walk. Another type can be meditation. So when I talk to my patients, I have them do a foundational exercise, and it can be breathing. So here we go. Okay. So I want you to close your eyes. Okay. And I want you to take a nice big deep breath for 4 counts. Expand the diaphragm, 2, 3, 4. Hold that breath now for 7 counts. 3, 4, 5, 6, 7. And make a nice big exhale and release. And we do that over 8 counts. 3, 4, 5, 6, 7, 8. And that's a practice that we do, and that's just one way. We did it super fast right now, but really it's
I'm already feeling relaxed.
Everyday practice.
Yeah, we've talked about the importance of breathing before, and I had said that I had started sort of practicing breathing, and I was surprised at how it slowed down my heart rate. Things that I didn't think I could physically feel, but were actually happening inside me. Right. So it makes sense. And these are the sort of techniques that people. So how would you do this? Would you do this during the day? Would you do this on a regular basis? What practice has had the most impact?
Right. So it's exactly that. It's a practice. So we need to understand that with mindfulness, you can practice any form. So for example, meditation, what you do on a bad day, you do on a good day. Just like individuals train for sport, you train for that game day so you could perform really well. And so with mindfulness and meditation, you want to make sure you establish a ritual. You practice it every single day. You can do it alone. You can do it with your loved ones, your family members, bring in your children on in it. So then you have that practice so that on game day, game time, when the challenge of migraine pain happens, that challenge can be met with this practice that you've been doing all along.
I love it. That is such good advice. And, you know, it's not just good for migraines. It's good for a whole lot of other stuff, too.
Absolutely.
Dr. Cynthia Armand, thank you very much.
Thank you.
This program is brought to you in part by Ubrelvy.